So tell me, do you know what your thyroid is, where it is, what it does? I'm thinking that you should know that. Hi, I'm Donna Denson, the Dynamic Diabetic, and today I want to talk to you about your thyroid. Why? Because your thyroid can affect your diabetes. So, thyroid problems. The American Thyroid Association says there's an estimated 20 million Americans that are having a thyroid issue, but up to 60% of them aren't even aware of it. That means a lot of us are walking around with something going on in our body that we are not alerted to yet, we're not aware of, conscious of yet. Women are more likely to develop thyroid issues, actually 5 to 8 times more likely than men. And 1 in 8 women will develop some kind of thyroid problem in their lifetime. So, what is your thyroid? It's a butterfly shaped gland on the front of your throat, and it produces hormones. Those hormones control our metabolism, our growth, our development, our body temperature, our energy, and for children, it helps in their brain development. So it's a very important organ for us, right? Most common, or gland for us, most common problems are hypothyroidism and hyperthyroidism and Graves' disease. They're all a little bit different, but I want to talk to you about them and the symptoms of them, okay? Hypothyroidism is an underactive thyroid. It's not producing enough hormones to do the job that we need it to do. So, what would be the symptoms of that? Low energy, you might gain weight, you might have your face puff up some, you might feel fatigued, you might have elevated cholesterol, be forgetful, have a very slow heartbeat, and a slow metabolism. Ladies, you could have a change in your menstrual cycle. Your hair could get dry. It could fall out. Depression, muscle weakness, slow reflexes, joint and muscle pain. None of that sounds good, right? But if you had some of those issues, you might want to get your thyroid checked. It does take a blood test to be able to tell for sure what's going on. The second one is hyperthyroidism, which is the exact opposite. This is an overactive thyroid, and it's producing too much thyroxine, okay? That hormone, it's just producing way too much. So it's going to make your metabolism go faster, right? It's similar to Graves' disease, although there are a few differences. Graves' disease is an autoimmune disorder that makes your body produce more and more hormones. Hyperthyroidism and Graves' disease have similar symptoms, okay? One is a goiter. If you don't know what a goiter is, it would be a real swollen, heavy thing under your neck, on your neck, under your chin. You might have a rapid heartbeat, be nervous, could still be fatigued, have an increased appetite, lose weight. You might sweat a lot. That is a big key. Anxiety, muscle weakness, tumors, heat intolerance, another good sign. Change in your menstrual period, again, ladies. Irritability, lots of that. Thyroid is enlarged, so you might notice some swelling around your neck, and you definitely have heat sensitivity. Again, you have to have a blood test to be sure, but if you have any of those symptoms, you would want to have them looked at, okay? Symptoms tell you there's something wrong. And you need to see a doctor, endocrinologist, ASAP, not down the road, but ASAP, okay? If untreated, these problems can bring you additional problems to your body, your heart, your bones, and your muscles. Women may become infertile, and pregnant women, there could be birth defects. So this is serious. If you have some of these symptoms, you want to get it checked, and you want to do it ASAP. The good news is that thyroid issues can be treated. That's the good thing. How? Well, in hypothyroidism, remember you're not producing enough hormones. Well, you can replace those hormones. There are pills that you can take that can do that. Hyperthyroidism, where you're having too much, and Graves' disease actually as well, are both treated with a radioactive iodine pill. You're not swallowing that pill. If that doesn't work, then surgery is required to remove part or all of your thyroid, and then replace it with drugs, drug therapy. Another sign of Graves' disease, which is why it's different, it's hyperthyroidism, but it's different because it can affect your eyes. Your eyes can bulge. You've probably seen people whose eyes just seem like they want to bulge right out. They probably have Graves' disease. But there again, there are treatments. So don't want to scare you in that, oh my gosh, but it's when we don't take care of things, that's when we have these major issues. So if I can give you the information that you can take care of it at the beginning, that's awesome power for you. Knowledge is power. And it can help you to make sure that you don't have any further development. And why is thyroid disease important for diabetics? Because it interferes with your metabolism, okay? And that is going to interfere with your blood sugar. Yes. When you have thyroid disease, it increases your chances of developing type 2 diabetes if you don't have it. And if you do already have diabetes, type 2 diabetes specifically, it makes it a lot harder to control your blood sugar. So it has a great effect on us, and that is why you want to get it checked right away too, so that you're not, as a diabetic, having additional issues to deal with, because we got enough. We don't need anything else. I don't think we do. So that's my power for today. I hope that I found you safe, well, and happy. I'm always happy. But I hope you will share this video. Share, share, share. I cannot tell you how much it will help other people to get the same power and knowledge that you have. Okay? If you haven't subscribed to my channel, I don't know why, but please do. It doesn't cost anything. And you do get a lot of information. And it's power. Absolutely is power. This is Donna Denson, the Dynamic Diabetic. Thank you for tuning in, and may God bless and keep you until we connect again. Bye-bye for now.